Hello viewers, in this video we are going to discuss about Balanoposthitis, which is nothing but the infection of the foreskin over the glans penis, which is referred to as Balanoposthitis. So what is Balanoposthitis is, everyone will be having the foreskin in excess just because everyone has excess foreskin. However clean they are trying to keep, there will be some golden drops of urine which will be always wetting that excess foreskin. So what happens if the skin is getting wet, or what are all the possible sources of infection of the foreskin? If you look at it, the main three sources for infection are, one is their own urine, second thing their own semen, and third thing, after participating in intercourse, definitely there will be transfer of bacteria from male to female and female to male. So these three are the possible sources of infection to the foreskin. But in which group of patients this foreskin infection can happen is, mostly this foreskin infection happens in people with diabetes, or on people who are consuming steroids, or in immunocompromised individuals. So why only these group of people are subjected to foreskin infection is, obviously there will be decrease in the immunity in this group of people, thereby these normal sources like urine or semen and female bacteria can grow into a full-fledged infection in these immunocompromised people, especially diabetes, thereby leading to cracks over the foreskin. Why only this foreskin is subjected to infections is, always and always wet tissue is prone to injury and infections. For example, if we go to a beach and our feet are soaked in the water for longer duration, after coming out of the water, we can notice some cracks over the feet. We don't even know when all these cracks has happened or all these injuries have happened, but these do happen after getting wet. In the same way, this foreskin, just because it is subjected to wetness for long durations, this foreskin always remains at a risk for infection again. So if at all a person is already diagnosed with a diabetes, and if he develops this foreskin infection, what are all going to happen later? First thing, these people may notice cracks on the foreskin, especially these cracks happen after erection or after during intercourses, and once these cracks develops, slowly always the cracks or cuts heals with a scar. So what happens if these scars happen? Obviously scar tissue won't have that elasticity compared to a normal skin. So this scar tissue, just because it has lost its elasticity, if the person gets repeated scars, they will be having a repeated tightening of the foreskin, because scarring is happening, thereby leading to limitation that these people may not be able to pull back the foreskin well. Slowly over the months, these people notice that they are not able to pull back the foreskin at all, thereby the smegma or the normal secretions that get deposited between the penis and foreskin are left uncleaned, or the person is not able to clean it well. So what happens if these get deposited? These things may cause symptoms like itching, and these things may cause some burning micturition, that is pain while passing urine, and urinary tract infections. These infections may spread even up to the kidneys in few individuals. So to prevent all these from happening, strict diabetic control is important, and once they reach a stage that they are not able to pull back the foreskin well, definitely they need to go for a surgery called as circumcision.